Hi everyone, welcome to my page. My name is Dr. Kiruka Bijet at OBGYN Talks with Dr. Adazion. I'm a consultant obstetrician gynecologist. I discuss everything about women's health, children's health, and sometimes men's health on my channel. Thank you. If you have not subscribed, please subscribe. Follow me on Facebook page at OBGYN Talks with Dr. Adazion. Subscribe to my YouTube channel. I'm also on TikTok and on Instagram with the same name. Today we'll be discussing douching. Douching literally means cleaning, washing, and it means washing out the vagina with the use of water or any other mixture of liquid. Some people use a lot of things to douche. Some use water, just ordinary water, they will put it inside their vagina and use their hand to turn it and clean. Some others use hypochlorite, some use vinegar, some use soap mixed with water to wash. People use a lot of different things to douche. I want to tell you that it is not recommended that you douche. It is not recommended that you douche. So if you have been practicing it, know that you are doing the wrong thing because it has adverse effects to your vaginal health. Some supermarkets even have products that they display in their stores in a tube where people they call it douche products. People just carry it and insert into their vagina, press it, and the thing will now, press it inside and it will come with water. It is not recommended. It's against your genital health. It's against your health, and it's different from washing the vulva. The vulva is the external part of the female genitalia, while the vagina is the inside one. And the people that do, you see them put their hand inside to wash out. What are you looking for? The vagina is self-cleansing. The nature has made it so that it will cleanse on its own by forming mucus that will wash out the vagina. So it is not recommended that you douche. Now, this is where you should not practice douching. Nature has made the vagina to have different bacteria, different organisms, both the harmful ones and the good ones. They are in equilibrium, they are together, and they form what we call normal ecosystem. They're like brothers and sisters, and because they stay there, they give the vagina the healthy nature that it requires. Now, even the acidity that the vagina has, because the vagina is acidic in nature, that acidity helps prevent overgrowth of an infection or irritation. So when you now practice douching, you disrupt that ecosystem in the vagina. You prevent and stop that normal flora that you are supposed to have, that will give you the normal acidity of the vagina and the normal flora that will prevent irritation and infection overgrowth. So when you practice douching, you remove some organisms and some overgrow. So you now have things that will overgrow, like candida infection, that is, there is increased overgrowth of yeast infection, there is increased overgrowth of bacterial vaginosis, and the person will present with different symptoms like irritation. The person will be scratching, the person will present with foul smelling vaginal discharge. They're not supposed to douche. Now, peradventure, the individual has already an infection ongoing and you go on to douche. When you practice douching, what will happen is that you will now introduce that infection in the vagina into the uterus, and from the uterus it can get to the fallopian tubes. From the fallopian tubes it gets to the ovary, and the person will now present with pelvic inflammatory disease. That is how one of the reasons how pelvic inflammatory disease occurs. So if you practice douching, you will introduce the infection in the vagina into the reproductive tract, the uterus, the fallopian tubes, the ovaries, and they will start overgrowing there, and you present with symptoms of pelvic inflammatory disease. So douching is not recommended. Now, what are the problems of douching? It includes overgrowth of bacteria in the vagina. Remember I said the vaginal bacteria are in equilibrium. So they form a normal flora, both with the bacteria, the yeast. But when you remove one, there's what we call lactobacilli. It's in the vagina, and it makes the vaginal flora to be in equilibrium. So when you now start douching, you can remove the lactobacilli, and other abnormal bacteria will overgrow, leading to bacterial vaginosis. Person will present with abnormal vaginal discharge, fishy odor vaginal discharge, irritation. So that is one. It can lead to overgrowth of yeast infection, leading to candida infection. The person will present with excess candida infection. You know that this thing is candida. Now, the person, if the person is pregnant and you douche, you may introduce infection into the upper part, especially if the membrane has ruptured, and the person will present with bacteria preterm labor. Remember, I said that when you douche, you can introduce those infections into the reproductive tract, the uterus, the fallopian tubes, the ovary. And when you have pelvic inflammatory disease, it can affect the cilia of the tube. And so, even if there was fertilization, you'll not be able to pass through the tube and it may implant in the fallopian tube, leading to ectopic pregnancy. Ectopic pregnancy, abnormal implantation of a pregnancy in another part that is not the uterus. So it may lead to ectopic pregnancy. Other things that can form from douching include vaginal dryness, because you're removing the normal mucus, the normal vaginal mucus that helps to keep that place moist. So may come with vaginal dryness, and may come with irritation. If there is dryness, the next thing that will follow is irritation. And not just from that, from the infection that is already ongoing, from this equilibrium that you have created. So it is not recommended for any reason that you douche. It is not recommended that you douche. What are you supposed to do? You can wash your vulva. Vulva, remember I said, is the external part, the one you're not introducing your fingers into. Vulva is the external part. So you can wash your vulva and clean it with ordinary water or mild soap. Don't use scented tampons. Don't spray on your vagina or vulva to make it clean. Don't insert anything. Don't insert anything to make your vagina sweet. The vagina is supposed to have some small odor that is not really odor. It has its own scent. So don't go and start spraying something to make it sweet or something. Please don't insert anything that is being sewed into your vagina. You will disrupt the normal flora equilibrium and you may have problem with that. Douching does not prevent pregnancy. So you don't need to go and douche after intercourse to remove the semen. It does not prevent pregnancy. Douching does not prevent sexually transmitted infection before or after sexual intercourse. So it is not necessary that you douche. Don't douche. Allow the body to self-cleanse itself. Allow your vagina to self-cleanse itself. Just wash your vulva. Don't rub powder there, because you may even introduce talc, which may be a risk factor for ovarian cancer. That's a topic for another day. So thank you for watching to this point. If you have not subscribed to my YouTube channel, subscribe to my YouTube channel at Dr. Nkiruka Bridget, OBGYN Talks with Dr. Adazion. Follow me on Facebook page at OBGYN Talks with Dr. Adazion. I'm also on TikTok. Look for me at OBGYN Talks with Dr. Adazion. I'm on Instagram. I'll continue to discuss our health. Thank you. Appreciate me by hitting the notification button. Thank you.